from Silent Majority Foundation. We have what may be a major First Amendment win. Can you tell us what happened today?
Yeah, so we have been waiting for nearly 9 months, 8 months, for a decision out of Division 3 of the Appellate Court of Washington in regard to Dr. Wilkinson's case. Part of his case was based on free speech. And today, the appellate court has completely repudiated the idea that the Washington Medical Commission can regulate physicians' public speech or political speech. It is a wonderful decision.
Wow. Okay, so that sounds like it's having some, great bearing on our speech and sounds like medical freedom as well. Let's let's take it back a little bit. Remind me, what happened with Dr. Wilkinson? When did this start?
So this started way back. It was in September 2021 timeframe, right about the time that the Delta variant began to hit. And doctors were beginning to try to treat patients with ivermectin. Dr. Wilkinson received a myriad of complaints, mostly emanating from the hospitals. And he had to go up in front of the Washington Medical Commission. But part of the complaint that he received was the fact that on his blog, he had talked about the pandemic. And he had talked about the response to the pandemic in ways that the Washington Medical Commission did not approve. And they had numerous statements that he made in his statement of charges. We attempted to get those dismissed by the administrative law judge, but the administrative law judge insisted that he could not dismiss those statements. So he had to go through a complete hearing. He ended up with very harsh. Thank you. Very harsh discipline in which he was required to get a psychological, a physical, and a mental evaluation.
Wow.
And this was all just for treating patients early during COVID.
Okay, so let's break that down a little bit more even. So the who of this case, we've got Dr. Wilkinson, we've got a doctor out of Yakima, Washington, and
Right.
the people who brought the charges was the Washington Medical Commission, which is a commission that is appointed by the governor of the state of Washington.
Correct.
And they are the governing board of any medical provider, practitioner in the state of Washington that holds a license, correct?
Right. Physicians and physicians' assistants. Yes.
Okay. And they found that during the time of COVID, that were the charges, did they just include First Amendment? That what he was talking about on his blog was something that they didn't like, or were there actually any other malpractice charges that they brought against him?
So there were practice below the standard of care charges on several patients. And the appeals court today did find that the Washington Medical Commission had the right to regulate those. However, they found in no uncertain terms that they did not have the right to bring the charges against him based on his public statements. And yet they did. And that was a significant issue in his sentencing.
Right. So we'll put the medical, charges aside for now, because this decision largely just is on the First Amendment issue, the speech issue there. Because I think that a lot of us are going to disagree with the Washington Medical Commission on the findings they had on the medical side as well. But we'll leave that for another day and another discussion. So let's focus then on the what and the when of these charges. So,
The
like,
what?
what was the Washington Medical Commission statement and the FSMB who created these
Okay,
statements
right.
for these
So,
governing bodies?
yeah,
What was what emphasis
right,
or the genesis of these charges to begin with?
right. So the Washington Medical Commission created a position statement. And that position statement, I will read it to you, included at least the Washington Medical Commission supports the position taken by the Federal Federation of State Medical Boards, the FSMB, regarding COVID-19 vaccine misinformation. The WMC does not limit this perspective to vaccines, but broadly applies the standard to all misinformation regarding COVID-19 treatments and preventive measures, such as masking, physicians and physicians' assistants who generate and spread COVID-19 misinformation or disinformation erode the public trust in the medical profession and endanger their patients. So therefore, the Washington Medical Commission reserved the right to scrutinize any complaints received regarding what physicians were saying in those regards. And this included ivermectin and hydroxychloroquine. And they reserved the right then to discipline them based on misinformation and disinformation.
And this misinformation and disinformation was decided as a whole by the group, the FSMB. What do we know about them?
Right. So the FSMB is, it's called the Federation of State Medical Boards. And the Federation of State Medical Boards has members from all the medical boards in all 50 states. Now, they get together and they talk about the regulation of medical practice and so on and so forth. And then they promulgate policy.
Okay.
One of the policies they promulgated was this policy that the WMC picked up. And it read, physicians who generate and spread COVID-19 vaccine misinformation or disinformation are risking disciplinary action by state medical boards, including the suspension or revocation of their medical license due to their specialized knowledge and training. Licensed physicians possess a high degree of public trust and therefore have a powerful platform in society. Whether they recognize it or not, they also have an ethical and professional responsibility to practice medicine in the best interest of their patients and must share information that is factual, scientifically grounded, and consensus-driven for the betterment of public health. Spreading inaccurate COVID-19 vaccine information contradicts that responsibility, threatens to further erode public trust in the medical profession, and puts all patients at risk. This was the statement that the Washington Medical Commission adopted wholesale and then expanded to all COVID-19 information. And as we know now, the policies that were created were largely made up. We know the 6-foot rule was made up. We know that masking does no good, or limited, at the very least, limited good, right? And you have to wear the masks properly and the right type of mask. And in public, people do not do that. So we know that was a problem. We also are becoming more and more aware of the issues with the vaccine.
Right.
And so this whole statement really was saying, no, you physicians are forced to say what we tell you. And that's what the Washington Medical Commission adopted and then applied against various doctors in the state, including Dr. Cole, including Dr. Wilkinson, including Scott Miller, including Dr. Turner, including Dr. Lynn, including a variety of doctors in the state. And this is it was a real problem. And so from the very inception of these cases, we as the Silent Majority Foundation determined to start bringing First Amendment claims against the Washington Medical Commission to get them to back down. It took until today for us to succeed in that.
So let's on that line of thought, let's talk about timeline. So these charges against Dr. Wilkinson were first brought, you said in August of 2021. Is that correct?
Well, that's when the first complaints were made. And I think that his notice of, I would have to look at the timeline, but his notice of charges were, let me look and see. His notice of charges were given to him on June 22nd of 2022.
Okay. So just in that timeline, you know, we if we just go back and our memories may fail us a little bit, but we can remember that March of 2020 was really when governments started to step in the United States and affect any kind of mandates or you know, policy.
Right. That's
And
when
we know
lockdowns started and that kind of thing. Yes.
right.
Yes.
So we started lockdowns in March of 2020, and we continued these off and on. With sometimes they would lift them, sometimes they take them back. They would change these policies, making them more severe and less severe as we went through this process, until about the fall time of 2021, when the advent of a quote unquote vaccine was on the horizon. We
Well,
knew that.
so the vaccine actually had been introduced in December of 2020.
That's true. That's true.
And it had been introduced for healthcare workers and the elderly at that point.
That's right. So, like I said, my memory is failing us. It's been so long. But go ahead.
And then gradually, the people who could get the vaccine grew to other groups, right? By August of 21, we were beginning to see mandates for the vaccine, right? And by middle of October, Inslee's mandate took effect. Inslee actually announced his mandate on August 6th, and then October 18th, it finally took effect. Now, there were other mandates in there. So what we were seeing, but also the other thing we were seeing is that right around July of 21, the Delta variant began to take over the original variant, right?
Okay.
And began to spread more broadly. And it caused this huge uptick in hospitalizations and death. There are a lot of arguments as to why the Delta variant did that, but it's just a fact that that was about the time that the Delta variant began to affect different places across the country. In Washington State, it hit more like mid-August. Okay. And started to have a big effect in mid-August. So when all of these complaints started rolling in on doctors, it was about that time of the Delta variant when hospitals were seeing a huge surge. Right? It had nothing to do with the fact that doctors like Dr. Wilkinson were treating people with ivermectin. That surge would have happened regardless. And that surge did happen because very few people were being treated with ivermectin. So they were being blamed for something that was not their fault.
Gotcha. So let on the same timeline concept, 2020 starts lockdowns. Doctors don't know what the best treatment is. There are theories about what treatment for COVID-19 could be, but there's no standard of treatment yet. Various doctors are trying alternative treatments and sharing that information back and forth. And there was some scientific literature that was shared, but a lot of it was, once it was shared, was being hidden or taken down or censored by what would be considered government agencies and they were trying to come to a single consensus, right? And that's where the FSMB's statement comes out.
Right. Now, so in March of 2020, obviously the lockdowns and things started to take place. But the other thing that started right about then or shortly thereafter was Operation Warp Speed. Mm-hmm. Everybody wanted a vaccine, right? So we were propelling as quickly as possible toward the vaccine, and the vaccine was considered the savior and the way out of the pandemic. The thing is the vaccine probably could not have been approved under a EUA statute if something else proved effective.
Okay.
So there were good reasons to, keep hydroxychloroquine, ivermectin, and all of those things to state that they were dangerous and ineffective and so on and so forth. But even without that, you're right. Doctors were trying everything. They wanted to be able to treat patients and keep them out of hospitals. Hospitals should have appreciated that. They did not. And they did not precisely because the consensus, which interestingly enough was top down, you would think a consensus would need to be bottom up. That is not the way it happened. It happened top down. Stated that none of these things could possibly work.
So we had
without actually looking carefully at it.
Right. So we had a very, very narrow definition of what was consensus and what was appropriate in treating this, in spite of the fact that we didn't actually have enough knowledge or information to make a consensus.
Correct.
So then let's go ahead. Let's go back to now. We're back in 2021. There are some reports made, complaints made, based on this very narrow consensus, not based on any actual fact or fact finding or issues. Based on this consensus, Dr. Wilkinson was speaking out against and practicing against what was a narrow idea.
Right. Well, the thing is that consensus was whatever the government deemed that consensus to be, right? And so, yes, so doctors were forced then to not only treat patients according to that consensus, but according to these statements, also speak according to that consensus. And if they weren't going to follow the consensus in their speech, they were supposed to just shut up.
Wow. Okay. So we've kind of set the stage here. So the statements that you read earlier from the WMC and FSMB made it very clear that any doctors that fell under their purview or their authority would have to shut up, would have to be quiet, and it can only pass any information that they deemed correct.
Right. They would either have to shut up or they would have to talk about only what they were told they could talk about. They could yell that from the rooftops, but anything else they needed to keep quiet.
Okay. So then let's talk about Dr. Wilkinson. What were his specific charges and what were the disciplinary actions that they then took?
So in regard to his statements, there were, I'll read you the first paragraph of the charges and then I'll kind of just summarize the rest. Due to their quote, this is 1.7 in his charging document. Due to their specialized knowledge and training, licensed physicians possess a high degree of public trust and therefore have a powerful platform in society. What does that sound like? That sounds like exactly what the FSMB statement said. Physicians also have an ethical and professional responsibility to practice medicine in the best interest of their patients and must share information that is factual, scientifically grounded, and consensus-driven for the betterment of public health. Again, if not an exact quote, pretty darn close to an exact quote of the FSMB. When physicians spread inaccurate information and rely on their status as licensed physicians to bolster their message, it is especially harmful as it threatens the health and well-being of our communities and undermines public trust in the profession and established best practices in care. Okay, so that was the opening statement for the charges against his public speech. It went on to say, at all times relevant to this case, respondent practiced medicine in a clinic that he owned. From June 2020 through at least May 2022, respondent maintained a public website on which respondent identified himself as a licensed physician, promoted medical services he provided to patients in his clinic, and published a blog in which he provided medical information to the public. Between June 2020 and May 2022, respondent made numerous false and misleading statements in his blog regarding the COVID-19 pandemic, COVID-19 vaccines, and public health officials. Among the numerous and misleading statements respondent made or quoted others as making were the following. Okay, and so then they go through a whole list of quotes from his website. The first one is, "The pandemic is a scam," which is taken completely out of context. The next one is, "Polymerase chain reaction or PCR testing and the use of masks to reduce the spread of COVID-19 infection are useless." The next one is, "Public health entities, including the U.S. Food and Drug Administration, the Washington State Department of Health, and the Yakima County Department of Health are providing false information and are not to be trusted." And the next one is, "Ivermectin and hydroxychloroquine are effective in preventing or treating a COVID-19 infection." And finally, COVID-19 vaccines are dangerous and kill people, comparing the push for vaccination with the murder of Jewish people in Hitler's Germany. And then they bring up statements that he made that are contained in other longer presentations on his blog post. So they are explicitly talking about public statements he made, taking quotes out of context, and which doesn't matter actually, whether they're out of context or whether he actually said them as they claimed he said them. He had the right to say this, and that is what was found today.
Right. So let's get into that then a little bit. So he was charged with various frivolous accusations during this time medically, but primarily what we're talking about is his right as a person to be able to express his opinion. It's really what it comes down to.
Right.
Whether he's a specialist or professional in one field or another, this was his right to express his opinion, his beliefs, his thoughts, and that was really what was at hand here, correct?
Right. It was his First Amendment right, regardless of his position in society, to speak and to speak publicly. The court found a couple of really interesting things. First, one of the things they found in that this case actually revolved around was this idea that you have no right to false speech. The court actually found that that is not true, that even false speech is protected. And explicitly protected because it is inevitable that sometimes we are going to have false speech. So that is one of the first things that they find, which is very, very important when it comes to free speech. Just because you consider what someone's saying as false does not mean they do not have the right to say it. They do. So the upshot of this case which is very important for all of us to understand, is that the court completely repudiates this idea that physicians can be regulated as practicing medicine when they are simply speaking, that they have the right to these public statements. In a paragraph on page 45, they end the paragraph with, "We adopt these First Amendment arguments of Dr. Richard Wilkinson wholesale." That means that every argument that the WMC made, they didn't even give it a moment's consideration in terms of being applicable. They adopted silent majority's arguments on behalf of Dr. Dr. Wilkinson, wholesale. That's a big deal. Let me read to you that paragraph because it tells you what the arguments were.
Okay.
In support of his challenge to the constitutionality of WMC's discipline for his website blog, Dr. Richard Wilkinson resolutely insists that WMC disciplined him based on the content of his speech. Dr. Wilkinson adds that discussion about public health merits broad protection by the First Amendment. The government needs a compelling interest to punish speech about health, and the government must narrowly tailor its action to serve that compelling interest. According to Dr. Wilkinson, WMC has failed to meet either component of its burden. Also, if WMC disagreed with the content of his website blog, WMC could have aired public service announcements denouncing the positions of Dr. Wilkinson as fraudulent rather than punishing him. Although he does not concede that his website blog promulgated falsehood, he adds that the First Amendment protects false speech even if the speaker knows the speech to be false. Dr. Wilkinson highlights that WMC failed to prove that anyone read his blog, that let alone that any patient or other member of the public took action as a result of his blog comments. Wilkinson warns that today's orthodoxy in medical science changes with new scientific advancements. We adopt these First Amendment arguments of Dr. Richard Wilkinson wholesale.
The part that's, I mean, that paragraph's powerful, but the part that stands out to me and really, I think, is relevant to the conversation today in the world. They don't talk about misinformation or disinformation as those statements that FSMB and WMC came out with. They talk about specifically false speech. And I think
Correct.
that's really where the conversation needs to be headed, is it's either true or it's false. And you have to have a really good argument to prove that something's true or that something's false. And I like that they said that if the WMC had any problems with what he was saying, all they needed to do was publish something that they themselves came out with as true to counteract what he was saying that they claimed was false. But instead of doing that in the public sphere, they wanted to take this behind doors and, take them behind the shed and take a whipping stick to them.
Right. The bottom line in regard to that is that false speech, even when the speaker knows it's false, is protected. This is important. I mean, if you have ever done any kind of debate of any sort, you, especially on a debate team where you don't get to choose which side you're on, right?
Right.
You often have to make arguments that you actually know are false, because those are the arguments that support the position you are told you must take. If false speech is not protected, that completely obliterates the idea of debate altogether.
Right.
Anybody who has been in a discussion and said, okay, I'm going to be the devil's advocate, What are they doing? They are actually putting forth ideas that they know to be false and that they know to be wrong. Why are they doing that? They're doing that to make a point, to draw out the truth.
Right.
That would become constitutionally impermissible if we were to say that false speech could be regulated. This is a really, really bad idea to regulate false speech. And this is what the court says today.
It's incredibly important. It's incredibly important that we continue to have, I mean, in the light of the events of the past week, that we have the discussions, that we have those points and opposite points to be able to your point, really dig out the truth, find the truth. And, in photography, we talk about contrast,
Right.
the contrast is really what brings details into focus. And
Right.
that's what is required in a time where we have so much false and lies. And, we live in a time when technology creates things out of thin air. And we have to be able to discern truth in a much more difficult and convoluted situation. So I'm at the end of that decision, the last paragraph, the conclusion was, we reverse and dismiss the charges brought against Dr. Wilkinson for his clinic's website blog comments. And then we have a concurring decision, a concurring opinion as well.
Right.
What
And
do you want to dig
ahead.
into that a little bit?
Sure. Yeah. The concurring opinion, in fact, just below that paragraph I just read, where they adopt the First Amendment arguments wholesale, the judge goes on to say, Dr. Richard Wilkinson also contends that his pronouncements on COVID-19 constituted political speech that deserves the stoutest protection under the First Amendment. The concurring opinion, not this majority opinion, addresses political speech. In the concurring opinion, this judge makes it very, very clear that his political beliefs are completely contrary to Dr. Wilkinson's political beliefs. And yet he says that's exactly why they need to be protected. Because if his political beliefs cannot be protected in a blue state, my political beliefs and my political speech cannot be protected under the opposite. Right? So although he doesn't state it quite that way, that is what he's getting at. And he points out that Dr. Raymond McClelland, who was the WMC's expert, made it clear that Dr. Wilkinson's speech was political, and that COVID-19 had become politicized. And so he goes on in this. It's an incredible concurrence. It is really an amazing concurrence, and I would love everyone to read it, because this judge does such a fantastic job of laying out, it's Judge Fearing, of laying out why free speech is so important in our political context. But one of the statements that just jumped out at me that he said, the heart of some of the, so I already mentioned that Dr. Wilkinson had been required to go through physical, psychological, and mental evaluations. And he says the WMC's directive to Dr. Wilkinson to undergo a psychological evaluation likely went further and fueled conspiracy theories. The directive for an evaluation echoed the Soviet Union's diagnosing of dissidents as suffering from a psychiatric disorder.
Wow.
It's really quite an amazing concurrence. He goes on to talk about how it's free speech. It's the ability to listen to each other's completely contradictory viewpoints that protects us from violence. And he does discuss, let me see if I can find it. Forgive me, this is one I did not mark. I meant to. But he goes through a whole panoply.
I think that page 5 has so many great, great
Oh, it does.
excerpts.
Yeah, it does. It does. Yeah, so that we can do that, and maybe I'll find the other stuff I was looking for. The First Amendment equally blankets the dissemination of anarchist, libertarian, communist, socialist, progressive, liberal, Democratic Party, Republican Party, conservative, regressive, fascist, and even Nazi viewpoints. The drafters of the Bill of Rights intended the amendment to protect all popular and unpopular speech, orthodox or heretical views, sublime or profane under utterances, and provocative or banal messages. Unfortunately, political partisans increasingly refuse to recognize the non-aligned nature of the First Amendment and reject the idea that doctrinal opponents enjoy free speech rights. More and more, the exercise of free speech triggers violence, and conversely, this bloodshed frightens many from the exertion of First Amendment rights. It's a very, very, very powerful concurrence that I encourage everyone to read.
I can't help but look at that paragraph, and especially understanding that this judge, um, in your point about in this concurrence, was very, very clear where they stood personally, right, on the political spectrum,
Right.
which makes this opinion much more clear and powerful in the fact that a judge with a differing political opinion can find the neutrality of the First Amendment. And we really need to have that in the public discourse right now, even though we see those that federally are in power, maybe more leaning to the conservative or right side, do overstep that as well and do try and take their political adversaries out via unconstitutional means. What the Constitution does is it ensures that each of us maintain our rights despite which political party we may have an affinity for. But
Correct.
it also ensures that we don't have to go party to party and punish each other, imprison each other, because the Constitution already preserves those rights and ensures that one party doesn't have that power over another. And that's really the strength that I see out of this concurrence, is that one party doesn't have power over another. It doesn't require that we have this political um, warfare that we have right now, which has fallen into the courts as judicial warfare and litigation that is just eating up our resources, our time, and really digging into the fabric of what makes America great. And I finally feel like this is the first time as an organization that we have a judge that sits on the opposite side politically, reaching across the aisle, reaching out their hand and saying, you know what, this is what we can agree on.
Yeah. What we can agree on and what we can agree helps prevent violence, right?
Right.
If we can maintain that. He goes on to say historians see a similar disunion in American society. He just discussed what happened in England during John Locke's and John Milton's age. Today, places the country on the brink of civil war. Radicalized politics spawn support for violence against philosophical opponents. extreme views divide family members. High-profile politicians and pundits suffer bloodshed. The sniper death of Charlie Kirk, the assassination attempt on Donald Trump, the murder of Israeli embassy staff, the mass shooting at a congressional baseball game, the gunning of Gabby Giffords with the accompanying death of 6, the murder of Minnesota House Speaker Emerita Melissa Hortman and her husband Mark, the attended injuries to Minnesota Senator John Hoffman and his wife, the hammer pummeling of Paul Pelosi, and the bashing of United States Capitol Police on January 6, 2021. Shootings of targeted racial minorities add to the turmoil. The anti-Black mass shooting and death of 9 during a Charleston church Bible study, and the multiple murder of 10 African American at a Buffalo supermarket. Young people wonder about the safety and utility of public discourse. The First Amendment, needed now more than ever, precludes the majority from prohibiting dissemination of social, economic, religious, and political doctrine believed to be false and fraught with evil consequences. Those who won white men's independence believed that the final end of the state was to make them free to develop their faculties, and that in its government, the deliberative forces should prevail over the arbitrary. He goes through this panoply, and it's not one-sided. He goes through this panoply of violent acts that have happened for political reasons. And then he comes back to the idea that we need to be able to discuss things civilly if we are going to have a civil society. And political limiting political speech is only going to make things worse.
It just antagonizes the person that has the opposite viewpoint if they can't express their viewpoint, if they're shut down, if they're cut out of the conversation.
It leaves them no other options, right?
Right. The only other way to get their point across is to get violent or be violent. And that is what we're trying to avoid. Exactly.
And this concurrence goes through it very, very well.
Yeah, no, I'm been very impressed reading through it today, and I'm grateful for it. The question stands, though. What does it mean, A, for Dr. Wilkinson going forward, and B, any other cases that we may have with Silent Majority Foundation that include First Amendment rights or religious rights, and C, anybody else that may be having it's the similar conversation in courts around Washington or the United States. So let's start with A. What does it mean for Dr. Wilkinson?
Well, so for Dr. Wilkinson, they have remanded this back to the WMC to revise or at least take another look at the disciplinary action that they took. He has made it clear, I read that part in his concurrence, that this was Soviet-style requirements to label him as, basically psychiatrically sick, right? And so this opinion draws that whole requirement into question for Dr. Wilkinson. And we have the right to take it back to the WMC and request that they withdraw all of that. He has had to do most of it already because we could not get a stay on it. So we'll see what we can do about maybe, getting him some relief in terms of everything, the time and the money that he had to pay out for doing that. We'll see. No guarantees, but that is the direction for Dr. Wilkinson now. There are other doctors who are still fighting these kinds of things in Washington. This decision will be used, I can guarantee, by those who are representing them to help them get a good outcome in their cases. Now, I think that this is a case that is going to be widely picked up. I've already heard from several different media outlets wanting a statement.
Mhm.
And so people are already noticing it. So this is going to have ramifications across the country. It is a strong statement in favor of the First Amendment and in favor of the First Amendment, particularly for physicians and doctors. And it is going to be used, I have no doubt, in courts around the country to support the First Amendment and to bring it back from the brink.
Right.
So,
Do you, and you may not want to make comments, so you don't have to feel like you're obligated to. Do you feel like this has any bearing on our case with Dr. Renata Moon?
well, that is a First Amendment case, so I am sure we will be using it in that case. Yes.
Okay. Very good. Like I said, I think this is going to really have an impact on our foundation, the work that we're doing, the work that we've been doing, particularly on the First Amendment and with medical freedom. Incredibly exciting news. I know that I don't always portray my excitement very well. My daughter, in fact, says I have no feelings, so I can't get my feelings hurt. But we are incredibly excited with this outcome for Dr. Wilkinson that we've been
Yes.
working so tirelessly, so long on. And so I want to congratulate you, Karen, for this outcome. We're excited as a foundation for the work that you've done and been able to bring on behalf of citizens of Washington and these individuals that we are representing. And we want to continue to be that beacon of constitutional freedom. And you're a large part of it.
Well, thank you. Yeah, and I could not contain my excitement this morning. Normally, I'm pretty calm and level-headed, but this morning I was dancing. I admit this is a big deal. It's a big win, and
It
it's a big
is.
win for the people of Washington. So
Yeah, I believe so. Big win for everyone. So thank you for taking time to explain this to me as hard-headed and simple-minded as I am. I think I think I understand how great this is, and where this is going to go as far as the law goes. Do you have any closing statements for anybody?
well, I think the only thing I wanted to state that we didn't get to is that this was a unanimous decision. There are no dissents in it. And that with both the decision and the concurrence agreeing, and both of them being over 20 pages long, it's going to be a decision that, if appealed, the Washington Medical Commission is going to have to work really, really hard to overturn. I think it's going to be very difficult for them to overturn this. I mean, anything is possible, but this is a
Right.
really good decision.
Right. Well, the record's out there for everybody to see. We'll post the decision as well on our website and on our social medias and share it out. Now, this is to your point. This is ongoing. They can't appeal this, so we are
Right.
still fundraising for the fight. And any funds that come in for Dr. Wilkinson's fight will go towards that. Any additional funds that come in will go towards additional and the ongoing fight for medical freedom, for the freedom of speech and religion here in Washington and across the country. So we appreciate any donations that come from it, and the work will continue on. Thanks very much. Thank you for speaking with me, Karen, and God bless everyone.
Yeah, thanks, Rob. Yeah.